German Chancellor Angela Merkel is about to address Parliament to outline new measures to curb the spread of the coronavirus. They include an extension of the partial lockdown until at least December 20th. Earlier, she called on Germans to make an enormous effort to try and improve the situation. Authorities here are concerned as the number of new infections has failed to drop significantly and the number of deaths has reached a new high. Well, joining me here in the studio is DW political correspondent Nina Haase. Morning, Nina.
Morning.
Merkel is set to address German Parliament any minute now. What corona plan will she exactly present?
Well, Merkel and the 16 regional leaders of Germany sat down for a really long session again yesterday to discuss the next few weeks, because the idea is to give people a bit of a breathing time around Christmas. So how can we relax restrictions during the very important Christmas period and still not risk infection numbers going too high? But she's about to speak now, so maybe she'll explain it herself.
We'll cross over to the German Parliament. We'll have Angela Merkel and the voice of an interpreter. Here we go.
Dear colleagues, ladies and gentlemen, 4 weeks ago, 28 October, the heads of government of the federal and the regional level decided, in the face of a dramatic exponential rise in new infection rates of the COVID virus, to levy far-reaching restrictions on contacts. These have been in force since the 2nd of November. They were inevitable because the health authorities in large part of the countries just did not manage to trace the contacts of infected individuals, despite staffing levels having been increased at every level. So the spread could no longer be prevented. And that, in part, caused the exponential growth. In my declaration of 29 October this year, I explained that the measures we had to take were appropriate, necessary and proportional, and why they were so. I also explained why there was no other, less harsh measure than restrictions on contact. This is what we need to do to stop and reverse the infection rates. Today, 4 weeks afterwards, we can find that the measures we took led to a 40% reduction in contacts, roughly, but then the dramatic exponential growth of new infection rates was indeed stopped. It's unimaginable to think where we would be today if 4 weeks ago, when it was really more than time, we wouldn't have done it. We wouldn't have been able to take this enormous effort. Part of this national effort, I would like to express my thanks here, was the agreement on the third law on the protection of the population, which this Parliament took last week. Our parliamentary democracy is efficient, is capable of making rapid decisions, and it is an anchor of trust for our citizens, particularly in these times. Dear colleagues, the worst thing to overtax the health system with all the medical and ultimately economic, social, societal and ethical consequences is something which so far we've been able to prevent from happening. This is a first success, but this is not sustainable yet. The contact tightening so far have sort of moved the infection rate sideways, but it has not yet reversed the trend downwards, which is so necessary. Or in other terms, the case numbers are stagnating, but at a high level, much too high a level, and infection rates are still rising in some regions of the country, instead of going down. We also see an increase in the number of people who are receiving ICU care because of contracting COVID. And yesterday we had a very sad record where, when we're looking at the number of deaths caused by COVID. And this has to give us grave concern, because it is still true. If we're using consistent measures, and would wait to take these measures until the ICU beds are full, the hospitals are overflowing. and they're already feeling the burden. But if we were to wait, it would be too late. This was the premise for our deliberations on 28 October, and it was again the premise for our deliberations and decisions yesterday. Medically and socially, societally and ethically, these were our concerns. I think just looking at the numbers in all our regions should be enough to convince us that we simply cannot afford to have the hospitals and the health sector overburdened. What a real lockdown actually is and what it would encompass is something which we don't see in this country, and we can be happy that it is so. But I must also say, in some of our neighbouring countries, we are also seeing that their numbers are rapidly going down. And I know I'm saying we don't have the harshest lockdown, and I still know that for many people in Germany, even our measures are very harsh, and that it causes fear for economic survival. Many people from the fields of culture, the hospitality sector, the hotel sectors can not at all or only partially work. And they're seriously worried about the forthcoming months. And that is why it's so important that we have all sorts of assistance and bridging aid packages costing many billions in order to cushion the effects of this pandemic.
Es kann gar nicht oft genug gesagt werden.
We can't say it too often. Combating the pandemic isn't about health or business, health or education or culture or social affairs. To think in these contradictory terms is a very frequent misunderstanding. It's always both together, health and business, health and education, health and culture, health and social affairs. In combating the pandemic, we have the objective of protecting the health systems from being overburdened, but this also serves everything and everyone else, particularly social cohesion. Our objective is and will remain to get the infection rates down enough that the health authorities are still able to contact trace. So we need an incidence of smaller than 50 per 100,000 inhabitants in 7 days. The main objective is and will always remain that everybody who needs treatment for COVID or any other point can receive the medical care they need. We have a strong health system which has so far withstood the strains of the pandemic, and we must make sure that this continues. It is against this backdrop that the federal and regional leaders decided yesterday first that the contact restrictions decided on 2nd November cannot be eased. That would be irresponsible. Second, the contact restrictions from 2nd November need to be extended beyond 30th of November and in some places need to be supplemented by additional, even tighter measures. On this basis, we made our decisions yesterday. We will once again appeal to our citizens to avoid all unnecessary contacts. And that also means private trips, tourism trips. The skiing season is coming. We're trying to come to an agreement in Europe whether we manage to close down all the ski resorts. Sadly, it doesn't look like it when one listens to what we hear from Austria. It doesn't seem to be easy, but we will try once again. On 28 October 2020, measures were agreed and will now be extended. As far as wholesale retail trade and retails will remain open, we're saying that sales space from 800 square meters will have a restriction. In other words, only 20 square meters will be available per customers. That is particularly true for shopping centers where we're looking at the overall sales area. People always say, well, there's mandatory mask wearing, and if people wear masks, then that's not dangerous, there's no risk. Let me comment on this once again. Wearing a mask and I am grateful to all citizens who really keep to the mandatory mask wearing. It does reduce the risk of infection. Yes, it is protection. But if we don't have FFP2 or 3 quality medical masks, there is no guarantee that infections will not happen. And this is exactly why we want to avoid having large numbers of people gathering in shopping centres. I think we need to inform people properly. We mustn't make them feel falsely secure. Face masks plus social distance, that's the best solution. Otherwise, a mask is a protection for me, for everybody else, if everybody does it, but it isn't a guarantee. And this is what needs to be emphasised time and again. Yesterday, we also made a forecast about what we will see happening over Christmas and on New Year's Eve. Because of the pandemic situation, we assume that the restrictions which will be enforced before Christmas will have to stay in force, at least for most part of Germany, even after January. Should there be a dramatic reduction of the rate of infections in the forthcoming weeks, then different conclusions can be drawn, and we will check it before Christmas. But people have a right to know what to expect, and sadly we have to say that we cannot really promise you relief for Christmas and the New Year. We also decided yesterday that we have very different infection rates in different parts of Germany. We have a very small number of districts where the infection rate is below 50. In other words, 50 per 100,000 people in 7 days. We've got 62 districts and the city-state of Berlin, where the average infection rate exceeds 200. And that is why we still have our hotspot strategy, which applies to everything which exceeds the 50 per 100,000 incidence rate, which is why we've done the measures we have taken. So let me say once again that in addition to all these comprehensive measures, other further-reaching measures can be taken, from some areas like Hildburghausen in Thuringia, where incidence is extraordinarily high. There is even a curfew, shop closures, school, childcare closures, which were taken. And I can only say we can't live from the average valley, because Schleswig-Holstein, Mecklenburg, Western Pomerania are doing very well, but at the same time, Thuringia and Saxony, we see infection rates rising, then the average doesn't help. We need to react in a locally appropriate and adaptive way. The regions wanted to make it possible to have further measures if the 200 incidence rate is increased, and I think that is necessary. That's what we want to make possible, so that the overall rate can be reduced. We emphasized yesterday once again that the be-all and end-all in dealing with this pandemic and the infection is to reduce contacts, and if there are contacts, they have to be following the established rules. And this is why private meetings are particularly important. Excepting Christmas and the New Year, we are once again tightening the rules, saying that private gatherings should only be between 2 households up to 5 people, not including children below the age of 14, because they are not so relevant for the infection rates, as we know. So 5 people from 2 households, exempting children of below 14 years. Face masks are made, face mask wearing is made mandatory in all busy areas, streets, squares, at work. Obviously, we know that mask wearing is mandatory if you can't keep the 5-meter required distance. Universities and other institutes of education should move to online tuition, with a few exceptions, from 23rd December to 1st January, Christmas and the New Year period. Special rules have been agreed. Here, it should be possible that people from the close family and friends shall meet up to 10 people maximum. And I would like to say expressly, it is up to each and every one of us to decide whether that maximum should really always be used, or whether maybe one can sacrifice this. But also here, children under 14 are not counted. The holidays, school holidays, will start on the 19th of December in all regions of Germany. And all those who paying visits to friends, family, particularly older members of the family like grandparents, should have a week during which they protect themselves before the visit. And during that time, they should minimize contact as much as possible to make sure that Christmas can be a safe period, because we don't want the festive days to be a spreader event. That is what we would like to see. As far as religious communities are concerned, we will talk to them at federal and regional level to come to agreements for church services and other religious meetings. Large-scale events must not happen, also from religious communities. And as far as the public scene is concerned, we are not going to have public firework displays in Germany. And at certain squares and cities and streets, it can be banned. And the general recommendation is to make do without fireworks. If you want to have a small private event with your own fireworks, we don't want to ban it, but we appeal to responsibility. We would like to ask every employer and everyone to come to maybe generous free time rules or holiday rules to make sure that people have as few contacts as possible at work, because we are easing the restrictions slightly for private purposes over the festive days. As far as care homes, senior residences and so on is concerned, we don't want them to be excluded from social contact. They should have the possibility of receiving visitors, because it's very important that we don't just think of our own families, but also of those who have a very, very hard time in this period of the pandemic, and we really should do all we can to ease their lot. In this context, let me say something about the protection of vulnerable groups too. We have thought that a certain number of FFP2 masks should be provided for the winter to vulnerable groups. Health Minister and the responsible Health Committee of the German Parliament have defined who would be eligible. And that's 27 million people. So nobody should act as if vulnerable groups can be protected in a country if that vulnerable group is 27 million. And you can't just take them out of all public space. We can't do it, and I think ethically it would be unimaginable as well to make that utterly clear. Yesterday, the issue of school and childcare took a very large part of our deliberations. We want to make sure that childcare facilities and schools can remain open, and this has now been agreed. Mandatory mask wearing is going to be tightened, the rules for mask wearing. We agree on that. We also said that the Robert Koch Institute has given recommendations, particularly for older school students, and particularly in those areas where incidence rates go over 200 cases per 100,000 inhabitants there. Blended learning and hybrid versions of tuition can be arranged. I think it's absolutely necessary. I know that we as the federal government are not directly responsible for schools, but we have responsibility for the infection, and we cannot act as if older school kids make no contribution. So yes, let's keep schools and childcare facilities open, but if we're talking hotspots, and that would be an extreme infection rate if we have more than 200 cases per 100,000 inhabitants. Let me remind you, we want to go down to 50. And if the rates are as high as I just said, then we need to act. We also see that we must make sure that we have a staggered start of the school day, so that, again, contacts can be avoided, reduced. We've developed a new strategy for schools as well here. Mr. Lauterbach of the Social Democrats have worked on that too. He's not here right now, but I'm sure you will tell him. He's one of many people who have helped us to work out the schools can react well. Cluster isolation is what we want to provide. In other words, the health authority decides which group of students, if there is a case of infection, has to be closed off in a sort of cluster quarantine for 5 days. And then we should have antigen rapid testing to make sure that we can work out what happens. And after 5 days, because 5 days is a comprehensive timescale, it also relieves the burden on the health authorities. And overall, I think that's a good solution. The antigen rapid tests are going to be made available in much larger numbers than previously. The quarantine rules are therefore going to be changed. Quarantine is reduced to 10 days. So you have the free test, the antigen rapid test after 10 days. So that will definitely improve quarantine rules. And this will come into force on the 1st of December. Ladies and gentlemen, obviously we discussed the economic assistance programs as well. And here I would like to particularly thank the Parliament. We proposed a November aid package. I know that's a great burden, particularly for the Budget Committee, and what we will do. That will have to be supplemented by a December assistance as well. We will do it, but I must say it has to be proportional. In other words, certain contact restrictions, certain measures simply have to be, so that we have the strength to make sure that those who carry the burden, particular sectors of industry, they carry the burden for all of society, so that we can keep schools open, businesses open. The cultural and hotel and hospitality sectors bear a great burden. So it is in our great interest, joint interest, to reduce contacts to such an extent we see an impact. Because obviously we cannot continue with this assistance ad nauseam, because we are making a huge contribution which causes great borrowing, and the national debt is rising for 21, 20, 21. It's necessary. We have to make sure that everything really fits and is proportional. Obviously, the Bridging Assistance 3 has been discussed as well for November and December. I mentioned that. We hope that, as far as vaccinations are concerned, marketing authorization can be granted relatively quickly. It won't solve the problem immediately, but it means there is light at the end of the tunnel. And the winter months, I'm sure many people who haven't been vaccinated will have to get through it, but I'm sure that next year we will see progress. It couldn't even be possible that vaccinations will reach us before Christmas. We have, however, agreed that, so should that be the case, this vaccination will be given to those people who are working in the medical sector, healthcare professionals. They should have the first call for the vaccinations, and I think given the risk that these people take, that is right. Ladies and gentlemen, let me once again advertise our Corona tracking app. We've improved it a great deal. I know there's a lively discussion about it, which will be continued. The regional leaders are going to meet again with experts, because among the premiers of the regional states there's been a lively debate about it too. More than 23 million people have downloaded the app. And I can only invite everybody who's listening now and who hasn't yet downloaded it, please do so. Dear colleagues, the COVID pandemic is and will remain the greatest challenge since World War II, for Germany, for the European Union, and for the whole world. But there is reason to hope as well. And this hope rests on the vaccinations. But we also have hope because we now have so much more knowledge about COVID-19 and its impact than we had at the beginning of the pandemic. This knowledge allows us many things. But at the same time, it is rather sobering, because we know it's a virus that cannot be cheated, cannot be avoided. It is the way it is, and it has its behavioral patterns. And I find it absolutely amazing. When we're looking at simple contact numbers, you can simulate that in science, and they can calculate what the infection rates are going to be after a certain period of time if we act this way or that way. And that's why we know there simply is no way around the virus, by saying, oh, well, we can force it somehow to act differently just because it's in Germany or because it's a school or somewhere else. So greater knowledge gives hope, and we also have hope that the great majority of people in Germany are keeping to these rules that we agreed on, and therefore make a reduction possible. Let me say very clearly, it's up to us. We are not powerless. Without any doubt, we have difficult months ahead of us. But the way in which people have overcome so many problems in the history of humankind, even now, during this pandemic, every single one of us can actively contribute to getting through this period well. When I spoke to this Parliament on 28 October, I said something I would like to repeat. The winter's going to be hard, but it is going to end. And particularly now, and we're thinking so much about Christmas, about the New Year, I would like for myself, for all of us, that we can, more than ever, be there for one another. If we do that, we will emerge from this crisis. Thank you.
And still with me in the studio is DW political correspondent Nina Haase, which is great because there is a lot to unpack. Nina, Merkel there outlining in Parliament the extended lockdown measures which were discussed at length. What are the highlights for you from those?
First of all, I always find it impressive how Angela Merkel knows her details. I mean, I observed her in Brussels during the financial crisis, and it's the same in the corona crisis. They had 7-hour-long negotiations yesterday, and she does know every little paragraph that was discussed with the regional leaders. So she went through this plan, what needs to be restricted, what needs to just be extended till Christmas, with a clear goal being, OK, we still have high infection numbers. Some of the measures seem to have worked, but the numbers are not going down as fast as we would like them to be going down. And so this is why extended measures are necessary, and we even have to intensify them in certain areas so that hopefully we can give families a bit of time to breathe during the Christmas period, which is, after all, for Germans, the most important family holiday period.
Christmas was very interesting. She left a lot of wiggle room in what people can do as to how they navigate their Christmas. The first thing we heard was 10 people. Then kids under 14, they don't count. And then the bottom line is that people will have to make up their own minds as to how they count and how they navigate Christmas. Another example of Merkel leaving room for this to take place.
But that's been her strategy all along. She knows full well that this is a virus. She is a scientist by trade, let's not forget. So she knows that the virus will spread, and it's not something that you can fight with rules only. So she is and has counted on the German population to understand why those measures are necessary, and then for each and every individual to draw their own conclusions. But she did say explicitly that now she has to interfere in the private sphere because, of course, this is something, if we don't act now, hospital beds will fill up very quickly, and then the German health system, like in many other countries, might also be overwhelmed. So she is very reluctant to do that, which is why she's not saying we'll have the police come knocking on your door. This is not what's going to happen. She's appealing to Germans' conscience and say, OK, we saw a record number of deaths in Germany from COVID or COVID-related yesterday, which was 410. That is a record number. And also the regional leaders kept saying this is something where we're talking about individual tragedies. Let's not forget that.
It was a very powerful last 5 minutes where she seemed to be speaking directly to business and all the people she'd been negotiating with for the past 7 hours yesterday. How do you think she balanced that hope, the carrot and stick, so to speak?
Yeah, she said it. She said, you know, we can't separate one from the other. The health issue goes hand in hand with the economy because, of course, we need strong economic actors to keep the system afloat so that we can help the more vulnerable who are affected by this pandemic, which is also why the federal government in this crisis has done something that is completely unprecedented. They're paying out billions of euros to these industries that are being affected by the partial lockdown. And this is highly unusual. This was applied now in November, and this is also going to be extended well into December, just to make sure that there are still people who can pay their bills so that the system can still work, so that the hospitals can work, the police can operate, etc. And we're talking about some sums like 17 billion euros for December alone.
You've taken on a podcast looking at Merkel's last year in office. Watching her very, very closely and then today, what did you see from the Chancellor in terms of what was yesterday? How's she holding up, having this crisis as she starts her last year in office?
just look at the polls before the crisis and compare them to where she's faring now. I mean, Merkel strives in crises, and this is just another example. This speech was extremely good. It was very personal by her. You know, by her standards, she appealed to people's conscience, and she still also gave people the opportunity to understand the details. So she doesn't just give you big slogans, she also explains little measures and why she feels it's necessary.
DW political correspondent Nina Haase, thanks so much. And at the German Parliament is our chief political editor, Michaela Kufner, who is also listening in to the Chancellor's speech. Michaela, give us some of your highlights, if you will, of Merkel's address to lawmakers.
Well, clearly, she made a point of explaining every single detail. She now is listening to the response of the far-right AfD party, which is the largest opposition party in parliament, saying that the damage from those measures is worse than COVID-19 itself. Angela Merkel herself argued that with some 27 million people in Germany, that's about a third of the population deemed a risk group, that simply doesn't hold up. If you look at the facts, those are also people who will be provided masks, but we can also tell that she is on track to try and get some European consensus on those weeks ahead. She wants to get the skiing resorts in Europe closed, and that will require quite a bit of European leadership, particularly looking at Austria, which of course relies on that income. Also, she's looking partially with envy and partially with horror to Germany's European neighbours. First of all, there are countries whose health systems are already near its limit or even further beyond that, like Italy and France. But then there are countries who've had a much tougher lockdown than Germany, for instance, Ireland, which are able to escape that, not just that exponential phase, but already on the way down when it comes to new infections. And that's clearly where she wants to get Germany. And we can also see here that she didn't get exactly what she wanted sitting down with those state premiers, because if it was up to her, and constitutionally it isn't, there would be much tougher measures in place throughout Germany, throughout those 16 federal states, but it also shows that she needs every ounce of the authority that she's built up over the past 15 years to keep those 16 state premiers, well, at least within line of what was agreed yesterday.
Michaela, in the live feed, we could see some troubled faces and some shaking heads. I wonder, in terms of the live audience in Parliament, how did her remarks go down in the German Parliament?
Well, she pretty much has everybody on board except the far-right AfD party, and they actually tap into that camp of COVID-19 deniers, flat-out deniers. That's not something the AfD itself is doing. They're also now wearing masks, but they had some of those activists in Parliament as guests, which created quite a stir here in Germany because they were essentially heckling MPs and ministers on their way to Parliament. The far-right AfD sees the latest set of legal measures, which was decided upon by, with a majority here in the Bundestag, as an attack on the Constitution. So we see quite a bit of political framing going on there by the far-right AfD party, which, after being against the euro, being against migration, seems to have found a new single issue to go by, which is that COVID-19 really isn't as bad and that it's potentially killing the economy. But if you look across Europe and the world, Germany is probably the country that has put the largest proportion of public funds into simply keeping the economy running for now. And so far, it has bounced back remarkably fast. But I'm saying that going into that second wave, and as Angela Merkel just said herself, it's a very grim winter. It will be a bad winter, but there will be a time after winter. And that's where all those hopes rest on the vaccine, which also was cautioned yesterday is not some kind of miracle cure so far.
From the German Parliament, our chief political editor, Michaela Kufner. Thank you.
Tuesday's record daily death toll has triggered alarm here in Germany. Why is this happening now, 3 weeks into a lockdown? Will a tougher lockdown reduce the mortality rate?
There's going to be naturally some opposition. It's natural, it's going to happen, but it is what it is. You know, there's no policy that's ever going to be 100% approved by the people.
I don't understand why restriction would be eased for Christmas. Perhaps one should stick to them. But I also see what happens with people when they're lonely and unhappy. So I can't say much about it, but I just talk about it because I also see how it is in hospitals. That's where I work. Yes, it's sad not to celebrate Christmas as usual, but how else? The measures taken are important and necessary. And there's always Skype, so we'll see.
All right, for more now, I want to bring in Dr. Maximilian Gertler. He's an epidemiologist working on the COVID-19 team at Germany's Charité Hospital. Dr. Gertler, it's good to have you on the show. On Tuesday, Germany recorded its highest daily death toll since the pandemic began. Do we know why the virus is claiming more lives now?
Yeah, I fear it's as easy as it is. We're seeing more cases, so we have to see more deaths. Possibly we also see more cases in the most vulnerable groups. So we see more people dying now, and we have to consider that the people dying now, they got infected 4 weeks ago or more. So possibly we will have to face increasing numbers also in the coming weeks.
What needs to happen to prevent the mortality rate from increasing?
I think the same what we did over the past months, what we should do better: reduce transmission, increase health education, increase testing capacities, and protect the most vulnerable groups of the population.
Tomorrow is Thanksgiving in the United States. People are traveling despite the Centers for Disease Control advising everyone to stay home. There is fear that this holiday could become a super spreader event in the U.S. Here in Germany, the coronavirus restrictions, they could be eased during Christmas. What is the advice from public health experts such as yourself? Could Christmas create a new wave of infections here in Germany come January?
I think we have to take it serious that this is possibly the date of the year where most young people meet their grandparents. So many of the more vulnerable age groups. And we will all ourselves have to consider either seeing less persons on Christmas, try to take a quarantine period before the Christmas days, at least a week. And we should have better access to rapid tests directly before the Christmas days.
Let me ask you, the German Chancellor, she has said that stopping the exponential growth of coronavirus cases, the spread, has only been partially successful. When you take that and you add it to the fact that we know that a vaccine is on the way, are you worried that in the new year we're going to see cases go up again because people are going to let down their guard?
Yeah, we should consider the vaccine as a Christmas gift, but we will not all have it ready for Christmas, and also not very early in the new year. We need billions of people to be vaccinated over the next year, and therefore there's no way out of of staying careful and reducing contacts and transmission.
Dr. Maximilian Gertler joining us tonight from the Charité here in Germany. Dr. Gertler, we appreciate your time and your insights tonight. Thank you.
Thank you. Welcome.